felt his ribs cracking. Should have started CPR soon. Horrible struggling with the emotional sensation of the ribs cracking. Ribs were cracking.
It blows my mind that up till today, most emergency response teams still do not debrief after cardiac arrest. These are comments made by real people after they performed CPR. Being involved in CPR can be very traumatic. Debriefing after cardiac arrest should always be a default. As an instructor who teaches on CPR courses, I can tell you that we do not teach people how to debrief. So this is how I debrief. First, the team leader starts by summarizing what has happened, what the patient's background is, what has occurred, and how it ended. The summary should be short and factual and non-judgmental. This helps the team make sense of what has just happened and also ensures that everyone is on the same page before the discussion happens. So the next bit should be about what went well, but make sure that you highlight good practices and give credit to people where it's due. Now, the more difficult bit comes next, which is to ask what did not go so well during the scenario. This can be difficult, especially if the patient didn't have a good outcome. For example, they passed away, because it can feel like you're trying to apportion blame. The trick here is to not ask what went badly, but to frame it as, what would you change next time to help things run smoother? Now, in this bit, it is very important that you are honest, but also be sensitive to your colleagues. It is important, therefore, that you read the room. Now, another tip here that might help you is to remember the golden 8 seconds of silence after you ask a question. If you've asked a question and no one answers immediately, make sure that you wait at least 8 seconds. In a group setting, it is quite common that people do not answer within the first 7 to 8 seconds. So resist the temptation to rescue the silence during that period. Now, if the room is very quiet, I try to prompt by asking 1 or 2 questions. One of them is, was there anything, equipment or support-wise, that you have wanted for future scenarios? Or was there a moment during a scenario that has impacted you the most? And the second question can be quite powerful because it acknowledges the emotional side of CPR. Then finally, before finishing, identify any issues that need to be taken forward, any equipment problems, or any training gaps. So I usually end by saying that I'm going to be around for the next 10 minutes to complete documentation. If any of you have any questions, please come and find me. And quite a few times when I'm doing my documentation, I actually hear crying coming from the pharmacy room or the kitchen. And it's usually a junior doctor or a nurse, a medical student, a healthcare support worker who has been quite affected by the situation and was unable to express it during the debrief. And this is usually a good opportunity for me to go and support them. Now, finally, please make every effort to debrief after CPR. Make sure that you look after your team as much as you look after your patients. I hope that helps.